Welcome to today's webinar, where we'll be discussing Comparative Billing Reports, or CBRs, and more specifically, CBR 202008 Breast Re-Excision. My name is Annie Barnaby, and I work for Rely Group, Inc., who is contracted with the Centers for Medicare and Medicaid Services, CMS, to develop, produce, and distribute CBR reports. We've developed various resources to accompany this webinar, and those resources are listed here for your convenience. We do have the webinar slides available to you, the recording of this session, of course. We have the handouts, and of course, the Q&A and CBR Help Desk are great tools to use if you have any questions. We're here to help, so don't be shy about reaching out to us. The objectives of today's webinar will be to understand the purpose and the use of Comparative Billing Reports, CBRs, to explain the function of this specific Comparative Billing Report, CBR 202008 Breast Re-Excision, and to help you gather resources that will help answer further questions and inquiries. To accomplish those objectives, our discussion today will cover the following areas. First, we'll talk about what a Comparative Billing Report, or CBR, is. I will show you how to access your CBR. I do have a sample CBR that we will review so that we can get a good sense of what we're looking at when we review a CBR. Then we'll go into a discussion of this CBR and go through the details of the topic and metrics for CBR 202008. And finally, I will show you some helpful resources should you have any questions following the webinar. So let's get started. Let's start at the very beginning. What is a CBR? Well, CBR stands for Comparative Billing Report. And according to the CMS definition, a CBR is a free comparative data report that can be used as an educational resource and a tool that providers can use for possible improvement. A CBR is truly just what the title says, a report that compares providers on a state or specialty and nationwide level and summarizes one provider's Medicare claims data statistics for areas that may be at risk for improper Medicare payment, primarily in terms of whether the claim was correctly coded and billed and whether the treatment provided to the patient was necessary and in line with Medicare payment policy. A CBR cannot identify improper payments, but it can alert providers if their billing statistics look unusual as compared to their peers. Taking a look at the history of the CBR, we can see that this program was spearheaded in 2010. In 2018, CMS combined the CBR program with the PEPR program, which is the Program for Evaluating Payment Pattern Electronic Reports, to put both programs under one contract. And then, beginning in 2019, Rely Group has partnered with TMF and CGS to create and distribute CBRs and PEPRs. Now that we have a sense of the history of the CBR, we can discuss why CMS issues CBRs. Well, CMS is mandated and required by law to protect the trust fund from any improper payments or anything else that may compromise the trust fund. CMS employs a number of strategies to meet this goal, which include education of providers, early detection through medical review, and data analysis. And CMS considers the CBR process to be an educational tool that supports their efforts to protect the trust fund. CBRs serve several purposes on the provider side as well. The CBR program helps to support the integrity of claim submission and the adherence to coding guidelines. This helps to encourage correct clinical billing. Early detection of any outliers in your billing processes can help to guide a compliance program that will help to support compliant operations in your own organization, and taking a closer look at specific coding guidelines and billing procedures can increase education and improve future billing practices. You may be asking yourself, why do providers receive CBR reports? A CBR is presented to a provider when the analysis of their billing patterns differs from the provider's peers on a state, specialty, and/or nationwide level. The analysis of providers' billing patterns is completed through each CBR topic, and each CBR is distributed to providers based on individual provider results for specified metrics within the CBR. The metrics for every CBR are created according to the CBR topic and the potential risk to the trust fund. It is important to always remember that receiving a CBR is not in any way an indication of or a precursor to an audit. I'm going to walk through the steps of accessing your report if you received one, so we can see exactly how that's done. This page, cbrfile.cbrpepper.org, contains the portal that you'll use to access your CBR. The portal does require that you enter some information, and I'm going to open this page on my screen to show you exactly what it looks like when a CBR is accessed in this way. First, we'll indicate the role that we play within the healthcare organization for the physician or physicians who received a CBR. I'm going to indicate that I am the CEO of the organization, and by doing so, I am indicating that I have the authority to receive the CBR information and that I understand that I am authorized to view this confidential information. Next, I'll complete these two forms to indicate my information and the provider information. To access this test CBR, I of course have used test data to complete these forms, but you'll use the correct information here to complete them. Following these forms, we're going to indicate how we heard about the CBR that is available for the physician or physicians. This section of the access form is most telling to us and helps us to know which form of alert is working best to reach the most physicians for their CBR alert. First on the list indicates that you received an email, a fax, or a letter. These would be communications that came to the contact information that is listed in the Provider Enrollment Chain and Ownership System that's commonly known as PACOS. We do encourage everyone to confirm their PACOS information and update if necessary, so that we can contact the appropriate person regarding CBR information. Confirming this information several times a year allows for that contact information to stay up to date and lessens any issues that may arise. Next on this list is an indication that you saw a tweet that we sent out about the CBR program. We do tweet about the CBR releases and about these webinars, so if you saw the tweet and that led you to check out the CBR program, we'd love to know that. The next two entries, Provider or Professional Association or MAC notice, are indications of our work alongside the groups and the MACs that are so supportive of provider billing and information distribution. We are very appreciative whenever MACs are involved in spreading the word about the CBR program, and similarly when a professional association recognizes the importance of the CBR program and the information that we distribute. We do have one alternative option, Other, and if that option applies, of course, please indicate as such. I'm going to indicate that I received an email. At the bottom of the form, we ask for the provider's NPI number. This will be the NPI for the specific provider who received the CBR. And I, of course, am going to use a standard test code for the NPI number. Then at the bottom of the form, we finally have the validation code. When a provider receives an alert that they have a CBR in file, a validation code is included with that alert information. So again, check the information on the emailed alert, the faxed alert, the letter to confirm your validation code. If you're sure that an individual provider was issued a CBR but you are unsure of the validation code, please submit a ticket to our help desk and we can assist with resolving that issue. So I'm going to complete the form and then hit Submit. And here we have the sample CBR file that appears. and your CBR will appear in the same fashion in PDF format, ready for your review. This page, cbrpepper.org, is another page that you can use to access your CBR. If you click on the Access Your CBR button, highlighted here with the purple arrow, you'll be directed to the page that we just reviewed, the portal, and you can begin the steps that we just covered. So we've seen how to access the CBR report. Let's take a closer look now at the sample document so we can fully understand this CBR, its metrics, outcomes, and comparisons. The results shown on this CBR will of course differ from those on your CBR if you received one, but the formatting and the sections on your CBR will be consistent with the layout of this sample document. This CBR is formatted into 5 sections, which help to focus on the process and results of the CBR. Let's go now to the sample document so we can follow along and look as we talk about each section. We start, of course, with the introduction. The introduction is a brief explanation of the specific clinical area addressed in the CBR. In this case, of course, it is breast re-excision procedures. You can see here information from the Journal of American College of Surgeons that discusses the rate of re-excision procedures in recent years. The introduction also contains the criteria for receiving a CBR. Moving on to the coverage and documentation overview, this section identifies the CPT codes that were analyzed in the report. Tables 1 and 2 are listed in this section. Table 1 contains the detailed description of the breast excision and mastectomy CPT codes. You can see those here. Table 2 contains the information for this sample provider for the allowed charges, allowed units, and beneficiary count during the analysis timeframe. The metrics of the CBR lists and explains the metrics used for the CBR, the list of specialties included in the CBR analysis, and the definitions for the specialty and national peer groups and the possible outcomes for the CBR metric analyses. The methods and results section is a review of the results for the CBR analysis, followed by individual results comparing the CBR recipient to other providers. We have an explanation of the dates of service included in the report analysis and the total rendering providers who had allowed charges for breast re-excision services. Following that information, the calculation for the metric is described, and then the results for the provider for each metric is shown in table form. This section also provides a graph displaying the trend over time for the provider. Finally, the References and Resources section lists reports and documents used for the creation of the CBR and those created to help you as you have questions about this CBR. Let's take a look now at the vulnerability of correct payments for breast excision procedures and how that plays into CMS's protection of the trust fund. We saw in the introduction information from the Journal of American College of Surgeons. The guidance and information listed in that article is at the heart of the vulnerability for breast excisions and re-excisions. That article showed us that the physician-level rate of re-excision reached a high of 91.7% between 2012 and 2018. The article discusses an expert consensus threshold of 30% for re-excision rates and the fact that 17.5% of providers exceeded that 30% threshold. To look at the rendering providers who submitted claims for breast excision procedures, the CBR 202008 was created. The CBR analyzes and reviews statistics for rendering providers who performed breast excision services. CBR 202008 focuses on specific providers' specialties, and those are listed here. The outcomes for the metrics and the comparisons will be based on the provider's specialty group, as well as a comparison to the national outcome. To create the CBR 202008 and the metrics within the report, we used detailed information for that data during the CBR summary year of March 1st, 2018 through February 29th, 2020. The results were based on claims extracted for the date range as of July 30th, 2020. Those results showed that over 10,000 providers submitted these claims, which represent over $73 million in allowed charges. When we talk about allowed charges, we're referencing the allowed charges listed in the Medicare fee schedule. This lets us compare similar charge figures across all providers and claim submissions, regardless of the submitted or paid amount. This analysis focuses on re-excision information for individual providers, so it is important to understand the definition of re-excision as it applies to this analysis. To identify re-excisions, the CBR team first identified excisions performed between March 1st, 2018 and February 28th, 2019, which became the base time period. The team then identified for each excision during the base time period subsequent excisions performed by the same provider. Any excision performed within 365 days of a prior excision was identified as a re-excision. Each of those re-excisions was identified as such within those 365 days. With the information regarding the definition of re-excision, let's talk about the metrics. This is a list of the metrics analyzed within this CBR report. Each metric was created to take a more detailed look at the submission of claims for breast excision services. The metrics are percent of re-excision, percent of allowed amount for re-excision, percent of beneficiaries receiving a re-excision. We'll break down how each of these metrics is calculated later in the presentation, but first let's take a look at each metric to understand why each analysis was selected and analyzed. Metric 1 analyzes the percent of re-excisions. This metric tells us of all the total excisions performed by the provider, what percentage were re-excisions? Using the threshold rate suggested in the journal article referenced in the CBR introduction, we assume that a lower percentage rate of re-excisions would be beneficial to the beneficiaries. Metric 2 analyzes the percent of allowed amount for re-excision. This metric helps to put a dollar amount to the analysis of re-excision. The outcome of this metric will show us the dollar amount from the provider's re-excisions as compared to their peers. Metric 3 analyzes the percent of beneficiaries receiving a re-excision. This metric looks at the beneficiaries affected by the re-excision rate for these breast procedures. How many beneficiaries received re-excisions during the analysis time frame? The criterion for receiving a CBR 202008 is actually not very complicated at all. If the provider had a re-excision rate that was greater than 30%, that provider received a CBR 202008. Let's look now at the outcomes that could come from each comparison for the metrics. All 4 outcomes are listed here. These outcomes are the basis of the comparisons made regarding the provider's billing patterns and those of their peers. The four outcomes that can come of each metric analysis are significantly higher, which means the provider's value is greater than or equal to the 90th percentile from the state or national mean. Higher, which means the provider's value is greater than the state or national mean. Does not exceed, which means the provider's value is less than or equal to the state or national mean. And then not applicable means that the provider does not have sufficient data for comparison. The significantly higher outcome indicates that the provider's value is greater than or equal to the 90th percentile from the peer specialty or national mean. In order to talk about exactly how we calculate the 90th percentile, let's go to our next slide. I think that the visual on this slide can help us understand the true meaning of the 90th percentile. In order to identify the providers who were above the 90th percentile, we calculated values for all providers for each of the metrics in each comparison group, which would be the peer specialty and nation. We then order all of the providers' values from highest to lowest. If you use the latter visual as a reference, imagine that the highest values are listed at the top of the ladder, and then in descending order down the length of the ladder, so the smallest values are at that bottom rung. Next, we identify the value below which 90% of the provider's values fall. This is the 90th percentile mark represented on the ladder visual by that black line. Any outcome for a metric in which the provider's value falls above that point would therefore have the outcome of significantly higher for the metric. Let's look at each metric individually and the outcomes for the sample provider on our sample CBR. Looking first at metric 1, the percent of re-excisions. To calculate metric 1, the number of re-excisions was divided by the number of excisions. Looking at the sample figures on the CBR for metric 1, which are on table 3 on page 5, you can see that this provider had a percentage of 36.36, with the specialty percentage falling at 17.34 and the national percentage at 16.82. The outcome of this metric for this provider is significantly higher for both the specialty and national comparisons. Next, we have metric 2, the percent allowed amount for re-excisions. Metric 2 is calculated by dividing the allowed amount for re-excisions by the total allowed amount for all excisions. With that in mind, let's see where the sample provider fell with their results. Those results are on table 4 on page 5. And we can see that this provider's percentage was 34.96. The specialty percentage is 17.20, and the national percentage is 16.64. These results produced an outcome of, again, significantly higher for both comparisons for this metric for the sample provider. Finally, we arrive at metric 3, the percent of beneficiaries receiving re-excision. This metric was calculated by dividing the number of unique beneficiaries who had at least one re-excision by the total number of unique beneficiaries who had an excision. Let's see the sample figures on the CBR for metric 3. This provider had an outcome of 57.14% for this metric. The specialty percentage is 20.48, and the national percentage is 19.72. So this brings a result of significantly higher for this provider for the specialty and national comparisons. The CBR includes a graph that represents the provider's billing trend over the 3 years, 2017 through 2020, for the number of beneficiaries for whom the CPT codes for breast excision were submitted. After the detail of the metrics and the analysis, it's nice to have this graph that takes a step back and reviews an overall analysis for that 3-year time period. And we can see the results for this provider for each code for each year. At this point, I want to review the resources we have available to you if you received a CBR, or even if you would just like further information about the process. We have a helpful resources page, cbr.cbrpepper.org/help-contact-us. On this page, you'll find Frequently Asked Questions link and a link to submit a new help desk request. I always encourage people to review the frequently asked questions before submitting a help desk ticket because those frequently asked questions may be able to answer your inquiry. Here is a closer look at the Frequently Asked Questions page, cbr.cbrpepper.org/FAQ. This page contains the list of frequently asked questions and has links to answers to various questions that you can see here. Simply click on the question and the answer will populate. This list has proven helpful to many people who have questions about the CBR process. These helpful resources are the documentation and reporting that the CBR team used in the creation and the analysis of the CBR. You can see the CPT manual and the guidance from the article that was listed in the introduction of the CBR. This is a screenshot of our homepage, cbr.cbrpepper.org/home. There are sections for each of these CBRs that we have released in 2019 and 2020. For each CBR topic and release, we provide links to a sample CBR, the training materials, the data set, and a link to access your CBR. This page also contains a link to join our mailing list to stay up to date on any announcements, a link to provide feedback on the CBRs, and a link to submit a CBR success story. We would love to hear how the CBR process worked for you and for your organization. Again, if you have any questions about today's webinar, please feel free to submit them to the help desk. Thank you so much for joining us today to discuss the CBR release, CBR 202008 Breast Re-Excision.